Hi everyone, my name is Ben Glass. I'm a 62-year-old CrossFit athlete, high school soccer referee, and attorney here in Northern Virginia. And I just want to cut this quick video to give a shout out to my friend, Dr. John Broussard. About a year ago, I sustained a rotator cuff injury, a slight tear of the rotator cuff in my left shoulder. And as you can imagine, this prevented me from doing a lot of things in CrossFit that I wanted to do. So basically, overhead movements, pushing, lifting overhead, doing snatches, pull-ups, swinging from the bars, all that stuff was really painful. In fact, even doing simple push-ups was painful in the shoulder. Before we really knew the extent of the injury, I tried chiropractic and PT, both which helped some, but we couldn't get past the pain. My great physical therapist, CAQSM, who works out of Halo Fitness in Burke, referred me to Dr. Broussard. And Dr. Broussard is a specialist in what's called regenerative medicine. So he and I had a consult, and we talked about an alternative to traditional rotator cuff surgery. And basically, I'm not a scientist and I'm not a doctor, but basically this is what I call stem cell therapy, where he took he would take fat cells out of one part of my body and inject them into my shoulder. So I'm a careful guy. I always like to do a lot of research. So did a lot of reading about the procedure. He gave me some articles. I did some other independent work. Saw that a lot of people were getting good results with this type of regenerative therapy or regenerative procedures on different joints in the body. Talked to some other CrossFit athletes who had done this, and also read the literature on the surgery, the traditional standard surgery. Ultimately, I opted to go with Dr. Broussard because I thought I would get a quicker recovery time, and I had a decent chance to get a great result. And I'm just here to report that it was an awesome experience. Dr. Broussard and his team took time to make sure that I understood, like every step of the way, exactly what could be achieved, how long it would take, and what was done, what was going to be done with the procedure. Procedure itself, I think it was in his office maybe about an hour and a half. Again, you don't have anesthesia, so you don't have the risk of anesthesia or the risk of going into an operating room setting that you would with traditional surgery. I came out and I wore a sling for about 2 days. Really, I was kind of back in the gym maybe 10, 14 days later, again, being very careful now with the shoulder, doing very easy range of movement exercises, no weights, of course, for a long, long time. And in working with my physical therapist, Carrie, we developed a program that really has gotten me back to about 95% of my pre-injury condition, and we're still working on that. So I worked hard. It took about 4 months to get back to sort of fully confident in terms of hanging and swinging from bars and things like that. So I would say this, if you have a diagnosed a rotator cuff injury, partial tear of the rotator cuff, talk to Dr. Broussard. I mean, each person is going to be different. I would say that no matter whether you have surgery or this procedure, you're going to have to work hard in physical therapy. I mean, I won't sugarcoat that. That part was hard. There was a lot of breaking of adhesions and stretching that needed to be done. But Carrie and I have worked very hard to make this a success. So I highly recommend you talk to him. He's awesome. He's great at explaining this stuff. He'll walk you through every step of the way. Give him a call. If you want to reach out to me, you can reach out to me, and I'll be happy to update you on my continued improvement from the stem cell treatment. It's an FDA-approved treatment, by the way, that Dr. Broussard offers. All right. See you next time. Bye-bye.